Anabolic steroids, science, use, and risks. Welcome to this educational video on anabolic androgenic steroids, AAS, commonly referred to as performance-enhancing drugs or doping agents. In this presentation, we will explore what anabolic steroids are, how they function in the human body, the difference between medical and non-medical use, physical and psychological side effects, legal regulations, and societal impact. The purpose of this video is to provide factual and scientific knowledge, not to promote or encourage usage. All information is based on medical sources and current research. What are anabolic steroids? Anabolic steroids are synthetic substances designed to mimic the effects of testosterone, the primary male sex hormone. Originally developed for medical use, these compounds help treat conditions such as testosterone deficiency, hypogonadism, delayed puberty, and certain types of anemia. The term anabolic refers to their muscle-building effect, while androgenic refers to the development of male sexual characteristics. How do they function in the body? Once introduced into the body, anabolic steroids bind to androgen receptors, particularly in skeletal muscles. This leads to increased protein synthesis, enhanced nitrogen retention, accelerated muscle growth, and reduced recovery time between workouts. However, these substances also interfere with the endocrine system, often suppressing the body's natural hormone production. Non-medical use and sports. Outside medical contexts, anabolic steroids are frequently used to increase muscle mass and strength, enhance physical performance, and improve aesthetic appearance. This type of use is prevalent in bodybuilding, fitness communities, and some competitive sports, despite being banned without a prescription in most countries. Risks and side effects. Physical risks. Prolonged or high-dose use of anabolic steroids can result in serious health consequences, including high blood pressure and heart disease, enlarged heart or cardiomyopathy, liver damage and tumors, severe acne and oily skin, gynecomastia or breast development in men, testicular shrinkage and infertility. In women, potential effects include deepening of the voice, increased body hair, disrupted menstrual cycle, and clitoral enlargement. Psychological risks. Aggressive behavior or roid rage, mood swings and depression, anxiety and paranoia, dependence and withdrawal symptoms. Legal aspects. In many countries, including Sweden, possession, use, purchase, or sale of anabolic steroids without a valid prescription is illegal. Violating anti-doping laws can lead to criminal charges and fines, imprisonment, disqualification from sports, damage to career and reputation. The World Anti-Doping Agency, WADA, classifies anabolic steroids as prohibited substances in all organized sports. What happens after you stop using? When anabolic steroid use is discontinued, the body may take weeks or months to resume natural testosterone production. Common withdrawal effects include loss of muscle mass, fatigue and depression, low libido, and hormonal imbalances. In some cases, medical intervention is needed to restore hormonal function. Social and psychological impact. The rising use of AAS among non-athletes, particularly young men, is a growing concern. Social media, unrealistic body standards, and access to illegal substances have contributed to the normalization of steroid use in modern fitness culture. Final thoughts. Anabolic steroids may have legitimate uses in controlled medical settings, but non-prescribed use carries significant health risks and legal consequences. This video is intended for educational purposes only. We strongly discourage any use of steroids without proper medical supervision. Instead, we promote natural training, proper nutrition, and long-term health. Discussion questions for viewers. How do social pressures influence our body image and fitness goals? What can schools and communities do to educate youth about the dangers of steroid use? Feel free to leave your thoughts in the comments. Don't forget to like and subscribe for more science-based videos on health and fitness.